Pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Vanotoo on Facebook and YouTube every Saturday at 4 p.m. on the online pregnancy school as she discusses pregnancy, delivery, and childcare with experts.
Hello, ladies and gentlemen. Once again, it is my pleasure to come your way with the online pregnancy school. I hope you are doing very well and also enjoying and learning from the sessions that we have brought to you so far. This is the online pregnancy school, and we are on this journey together. You remember, we are helping to reduce preventable maternal and newborn deaths and also help families to live healthy and fulfilled lives. My name is Dr. Linda Vanotoo, and it is always a pleasure to come your way with the online pregnancy school. For those who have been joining, sending us comments, sending us questions, we are very grateful. We encourage you to continue to do that. But if you have not yet been joining us, today is your first time, I want to encourage you to continue joining us. And in fact, go ahead and even subscribe to the YouTube channel, because you will learn a lot. There's so much that we have done. People have listened, people have learned a lot, and people have benefited, and it had helped them in a lot of ways. So please, if you have not yet done that, just go ahead and hit that subscribe button. In my previous session, I spoke about stillbirth. And today we are going to continue, but I want to just give you a little bit of what we learned in the previous session. We learned about the definition for stillbirth, and we said that this is a child that is born without any sign of life. The heart is not beating, there's no respiration, or the child is not breathing, and there's no movement at all. And this child is called a stillbirth. And this happens in a pregnancy that has gone on for up to 28 weeks and beyond. We use 28 weeks. In some places, they say 24. Some even go very low to about 20. But they look at the possibility of this child surviving if it were born at that time. And we use 28 weeks. So after 28 weeks pregnancy, if a child is born without any sign of life, then this child is called a stillbirth. Now, the two parts of this that I told you about are the ones that die sometime before they are born, which is called the macerated, and then the one that is born not too long after it has died, and that one is the fresh stillbirth. And we looked at some of the things that can contribute to the death of this baby, and we said that some of them are to do with the mother. If she has infections like malaria or syphilis or some other infection, or if the mother has some medical condition, whether that was existing before or during the pregnancy she developed that condition, for example, hypertension, then that can also lead to a stillbirth. And then we looked at the baby. If this baby unfortunately has any abnormalities that will not help this child to survive outside the womb, then this baby can be born dead. Or if there's restriction in the growth of this baby while the baby is still inside the mother's womb, then the baby can be born dead. And then we looked at the health system, that if the access to healthcare is not very good, and this mother, when she needs help, is not able to get the help quickly, then of course the mother can deliver this baby dead. So there are a lot of issues. And then there are also the issues to do with the family and the community, where there might be some beliefs that if you are pregnant, you go into labor, don't just go quickly as soon as you feel the pain. No, wait till the labor is well established, so that when you go to the hospital, you will deliver quickly, and you will not be there for them to be examining your tummy and examining whether the baby's head is down, whether the cervix is open or not. So some people think that they must stay at home for some time before they go to the hospital. So these are some of the things that we learned in the previous session. We are talking about stillbirth. Ladies and gentlemen, today I am going to continue with that discussion, and we are just reminding ourselves that some of these stillbirths are in fact unpreventable. Some of them we don't even know why they happen, and once we do not know why they happen, we cannot prevent them. But there are also certain things that we can look out for, which will help us as we move along to ensure that we don't have those ones that we can prevent, or the avoidable ones. That is what we are talking about. So what are some of the things that we have to look out for as we try to reduce these avoidable or preventable stillbirths? One of the things that pregnant women are taught to do is what we call the kick counts. And in our previous sessions, we have learned that when you go for the antenatal, in your card, they give you a certain sheet that you can record the number of kicks that you feel when the baby is still inside you within an hour. So you look at it, they teach you when to do this and how to recognize that this is a kick from the baby and record that. So within 1 hour, you record how many of these kicks you feel. And it is said that sometimes you can pick the time where you feel your baby very active and count those kicks within 1 hour and mark them. Or you kick 10 of them and see over what period these 10 kicks occur. Is it in 1 hour? Is it in 2 hours? So they will teach you how to do that. But we'll come back in future sessions to teach you what to do. But then there are these kick counts. That's why I always say that it is very important to go to the antenatal and take the antenatal seriously, please. And also, if you don't know something or you have heard something you don't understand, when you go, talk to the midwife. Do talk to the midwife and let that midwife or the doctor help you to understand. And for the fathers, please join them at least throughout the 9 months of pregnancy. Because we have 3 trimesters, go with your wife once per trimester, and then also join the pregnancy school, maybe once in each trimester. So we are talking about six times. That is not too much, right? I'm sure you can do that. So the men, please join. So they will teach you how to do the kick count, and you have to learn it. If you don't understand, please ask so that you know how to do the kick count. It's important because if you'll be able to reduce some of these deaths, then we need to know that when my baby is not kicking, I need to take action. Instead of just saying that this baby is asleep, please take action. So if there's reduced fetal kicks, or if you find that the baby is now moving too often, more than you are used to, it's also time to take action, because it may be that this child is telling you that I am in trouble. The child will speak to you that I'm in trouble. Too quiet, too active, more than what you are used to. Don't stay at home. Please go to the hospital, call the midwife, call somebody. Say that today my baby is just struggling, or my baby is too quiet. This is not how the baby behaves. So learn how the baby behaves. I'm sure you'll do that, right? Okay. Or if you find that all of a sudden your tummy has become very hard, when you touch it, it is painful. Though you did not feel any pain, but now it is so hard that you think there's something wrong. You don't feel this baby. Please go to the hospital. Or you see that you are bleeding, because once the pregnancy is established, it is growing, you should not bleed. So if you find that you are bleeding, it may be that the placenta has detached, or the placenta is not well positioned, and therefore it is coming out. Then please, even if it is your time to deliver and you are at home and you find that you have started bleeding, because once you go into labor, there should not be that bleeding coming out. So if you find that you are bleeding, please go to the hospital. Or if you find that you have suddenly started losing the water that the baby is lying in, also go to the hospital. What we are trying to say is that at this point, if you are not careful, the baby has been active all along, but now you see this blood, you see this water, your tummy is become very hard, or you have this severe pain, this child, if you are not careful and the child is not delivered as quickly as possible, then you might have a stillbirth because the child will be suffering. So don't do it that way. The other thing to do is that when things like this happen, when a baby unfortunately is born dead, at the hospital, there are a lot of things that are also done to find out what happened, so that if there's something that can be prevented, then in the future pregnancies, it is done for you and you don't continue to have these preventable stillbirths. One of them is that they will examine the baby to see whether there's something that will occur or can occur in the future. They will examine the baby to find out. And we also examine the cord. When the baby is born, you know that there's a cord that is cut for you to have the umbilicus, and therefore we examine to see some of these babies. What happens is that whilst they're in the mother's womb, a knot takes place. A knot takes place, like you have tied a knot in a rope, or the baby goes through, and this cord now goes around the baby's neck and kind of strangles this baby to death. So we would examine at birth to see what happened. And you know, some of these things, if you are able to do the kick counts and you know what is happening, you can take action quickly, so that even if there is this cord around the baby's neck and it starts being tight, the child will give you a sign and you go quickly to the hospital. The other thing is that if you were asked to do a scan and you did the scan, at the time that you were asked to do it, it can be found whether this cord is too long, the baby can go through, or you find whether the cord is already around the baby's neck, and then your labor would be planned, the delivery will be planned. So now, if you do not do that and you don't know that the cord is around the baby's neck, you go into labor and you stay at home, then what can happen is that as the baby is trying to come out, the cord will be becoming tighter and tighter and tighter, and that unfortunately can end in this baby's death. So it is important that we don't stay at home when we get into labor, or we don't stay at home when we find that there's something that is unusual about the baby or even about the mother herself. The other thing that is done is to examine the mother, because we want to see whether there's something that led to this baby's death that can occur in the future and stop that. So the mother is examined to find out whether there's something in the blood, because there are some things that can happen when the mother is of a certain type and the baby is also of a certain type. And that is why when you go for the antenatal and you are asked to do the lab test, whether that test is covered by the insurance or not, please do that test, because there are some instances where these things can happen and therefore the delivery has to be planned so the baby is delivered alive. The other things that are done when unfortunately a baby is born dead is to also look at what we call the post-mortem. To do that, this baby unfortunately is born dead, but why did this baby die? These things are done so that they can explain to the parents, explain to the people who conducted the delivery and took care of this mother that this is what happened, and that will help us to learn and also avoid other instances in the future. Now, when it is diagnosed that the baby inside the mother's womb is not alive, I told you that some of them, they die before the mother goes into labor. Others, when the mother starts labor. So now, if this has been found that this baby unfortunately is not alive, then what do we do? There are things that are done to try and get the baby out. One of them is called induction of labor. And this is where the mother is assisted. Some medication will be given, either inserted into the mother's vagina, or the mother is given some tablet or an infusion. They set up infusion on this mother and put some medications in it so that the mother will be supported to deliver this baby, because it is not good for this baby to be in the mother's womb. And the induction is usually done when the mother has some medical condition like hypertension in pregnancy. I told you that is one of the major causes of stillbirth and even maternal death. So when this mother has that, or the mother has a serious infection. Previously, I have told you that if you are there as a pregnant woman, the water should not be coming out. So if you are there, you find that the water is coming out, quickly go to the hospital, because it means that there's a break in the water, that the bag that the baby is lying in, so the water is leaking. If you do not go to the hospital quickly for them to see what can be done for you, you can be infected, and this infection can go even to the baby, for this baby unfortunately to have the infection and die. So if we find that the water is leaking and the baby is also not alive, they can do the induction for you. Or if they see that there's anything wrong, like if there's bleeding, they will check why this is there and then manage it accordingly. But just know that there can be what we call induction for this mother when the baby unfortunately is dead and is still inside the womb. So that is one way that the baby can be delivered if it is found that the baby is dead. Induction. The other way that the baby can be born is through the normal vaginal delivery, where they wait for this baby to come out by himself or herself. That is done over a period. So they wait for a while to see whether this baby would come out. If the baby doesn't come out, then it is time for the health team to take action. Because if this baby is left inside the mother's womb, especially if it died some time ago, it can create a whole lot of problems for the mother. The mother can unfortunately even pass away. I have seen instances where, because of where this mother was coming from, the baby had died some time before she got to the hospital, and you couldn't stand there. She was all smelly because the baby had died days before the mother came to the hospital. So it is important that we learn this kick count, we learn how the baby behaves, we notice immediately if there is something wrong, and quickly as we can go to the hospital. And that is why it's important to start preparing for your delivery even way ahead of time. So you don't stay at home and say that I don't have the money to go, I don't have the transport to go, I don't know who is going to go with me, I haven't bought anything for myself. No, you cannot wait till you get into labor to do that. So unfortunately, the case that I was talking about, this mother came in a very bad state, and unfortunately she also lost her life. So something that is avoidable happened. Even if the baby had died, at least the mother could have survived. But because she came late, maybe at home they tried to get this baby out in any way that they knew, but it did not help. So please, when you find that there's something wrong, just go to the hospital. Just go to the hospital. I don't think it should be a challenge, right? Go to any nearest health facility that you have. And if it's beyond them, they will send you to the next level. So this woman can be allowed to deliver, but they will not just wait forever. They will make sure that it is not unduly delayed and that it will not lead to infection, because now the baby is dead. There's nothing going on there that will protect this woman if any infection travels up there. So that is it. And then if they wait too long, also when the baby is born and they have to find out what happened, it will become a challenge. I told you that there are two forms. We have the macerated, where this baby is born sometime after the baby has died, and the skin peels off, is deteriorating. So it will be difficult if they have to assess this baby to find out what caused the death. It will be challenging. Ladies and gentlemen, today we are continuing with our session on stillbirth. And I'm talking about some of the things that can be done to help prevent some of these deaths that are avoidable. So if you have just joined us, please go ahead and hit that subscribe button and also turn on the notification bell so that you will never miss any program that we bring to you. And please continue to put your comments and your questions in the comment section. And if you want to send me a message via WhatsApp, the number is +233 59 242 0625. +233 59 242 0625. We have received a lot of questions, a lot of comments, and we are happy. And remember that even beyond these programs, we also have other programs that we run. If you need to have individual classes, if you need to have treatment for infertility, if you need to be attending the pregnancy school as a group, we have so many other things that we do. So please send me a WhatsApp message +233 59 242 0625. My name is Dr. Linda Vanotoo, and it is always a pleasure to come your way with the online pregnancy school. And also like our page on Facebook, The Pregnancy School. Yes, so we are talking about when it is found that the baby unfortunately is dead. How is this baby delivered? We have looked at what we call the induction, where some medication or medicine is given to the mother so that the uterus will contract for the baby to come out. But if they find that that is not working, they also go ahead and help this mother to deliver using different forms of interventions. Now, she can also be left to deliver by herself normally. And that one, they will not let it delay forever because she can be infected and that will not be good for her. The other way that this woman can be delivered is through cesarean section. Yes, through cesarean section. She'll be taken to the theater for the baby to be removed, because if that is not done and this baby is not coming out, it will not be good for the mother. So this is another thing that is done for this woman. Now, somebody would want to know, is stillbirth preventable? I have talked about some of the things that we can do to find out what happened. But stillbirth, can we prevent stillbirth? Some of them are preventable. A lot of them we may not be able to, but there are some of them that are preventable. In fact, I was listening to another country where they were also looking at the number of stillbirths which they believe was too high for them to allow to continue to happen, and they decided to do something about it to help reduce the numbers. And when they started, they were looking at reducing it by 15%, 15%, but they put in measures and they were able to prevent 23%. They reduced their stillbirth by 23%. So there are things that we can do to help reduce these numbers. And if you are just to be reminded of it, every year around the world, we have over 2.6 million babies born dead. And about 40% of them occur when the mother is in labor. So those 40% are the ones that we can do something about quickly. But the others, if we know about the kick counts that I've spoken about, and we do some of the things that I'm going to talk about now, then we'll be able to increase the numbers that we will save and reduce the numbers that will die. So what are some of the things that we can do to help prevent some of these avoidable deaths? And they should start not when you are pregnant, but even before you become pregnant. So if you're a young lady listening to me, whether you are about to get married or you have just been married, then please take a note that you have to go for a checkup. Sometimes you have some diseases that we do not know about. So go for a checkup. Assess the system that is there for you. Just access it. Let them find out if you have any pre-existing condition that will harm the baby if you become pregnant, and let them treat you. Go for treatment. And then for those who may have put on weight, please also go to the hospital, see a properly trained dietitian, somebody who can help you, a health worker who can help you to manage your weight. Don't on your own decide that I'm going to lose weight, so you miss this food or you miss that food. You may be getting malnourished and you would not know, and all that can affect the outcome of your pregnancy. So please, if you are trying to get married, just go to the hospital. If you're also a young man and you want to be married, also go to the hospital, have yourself checked. Maybe there's something wrong which will even delay the pregnancy from coming. So that is one thing that we have for you. If you are also pregnant and you want to know, you have to go to the hospital, go through the antenatal, go and do the lab test that you are asked to do the scans, so that they would know whether there's anything wrong or everything is going well. Then you know. There are also certain foods that pregnant women have to avoid. The ones that contain a lot of mercury. Some fish contain a lot of mercury. And also, don't eat food that is not cooked properly or that is raw. Don't beat egg, for example, and say that I'm drinking the egg or I'm using this egg in the raw form because they say that that is good. No, it is not good for you. It can lead to problems for the child and also for you. And also, it is important that when you are there and you have this severe lower abdominal pain, when it is not yet time for you or you start bleeding, please, that one, go to the hospital, because it may be that if you do not do that, the baby can easily die. If you bleed into the womb, this baby will not have the oxygen that the baby needs and the baby can easily die. So these are some of the things that you can do. The other things that you can do is to avoid smoking, avoid alcohol, because we have said it. If you drink, your baby is drinking. If you smoke, your baby is smoking. So as much as possible, stay away from these. And then also stay away from the use of those drugs. Even the medication that has not been prescribed for you, do not take it if you are pregnant, to avoid some of these preventable deaths. And if you find that there's anything wrong, please do not stay at home. Just go to the hospital and let them check up on you. And you remember, we have talked about the kick count. That one is key, that you measure what the baby is doing every day. So just be careful. After 28 weeks, when you are told to do that, please do it. Because I gave you the definition that the stillbirth is 28 weeks onwards when a child is born dead. So at that stage, this child can be born alive. Although we have what we call the early stillbirths and the late stillbirths, and we have the term stillbirth. So somebody can go through to 40 weeks, the full period of pregnancy, and some of them even beyond 40 weeks, and still have a stillbirth because they couldn't go to the hospital as quickly as possible when they felt that the baby was not moving well or was moving too frequently. They didn't take action. I know you will not do that, right? Ladies and gentlemen, once again, my name is Dr. Linda Vanotoo, and today we are continuing with our session on stillbirth. We have said a lot. Don't let this happen to you if it can be avoided. If you have questions, if you have comments, you can put them in the comment section, but you can also send me a WhatsApp message. Please, WhatsApp message on +233 59 242 0625. +233 59 242 0625. And you have not yet subscribed. If you have not yet done that, just go ahead and hit that subscribe button. Turn on the notification bell so you will know when we are coming up every Saturday, 4 p.m. GMT, YouTube, Dr. Linda Vanotoo, and on Facebook, The Pregnancy School. So follow us, like our page, give us a thumbs up, and send us comments. I will be happy to get back to you. So what are some of the other things that we can do to prevent stillbirths? Those that can be prevented. It is advisable that when you are 28 weeks plus and you go to sleep, you lie on your side, not on your back, on your side. And it's been found that when people lie on their backs when they are pregnant at that stage, those who have had stillbirth, there are more in them. And it's believed that when you lie on the side, the blood flow to the baby is better. Therefore, oxygen to the baby is better as opposed to lying on your back because of the anatomy of the human body and where the big vessels are. And during pregnancy, how the blood flows to the mother through the placenta to the baby. So it's advisable that you lie on your side. I'm sure a lot of you who have been going for the antenatal have been told that when you sleep, try and lie on your side. I know that when we sleep, sometimes we move around and therefore we might end up lying on the back. But as soon as you become conscious that you're lying on your back, please just turn and lie on your side. I hope you do that. And the husband will help the women to do that. So please do that. And also stick to the antenatal. It is so important. Go for the antenatal. You see, it's so important that the WHO has now moved it from 4 visits to 8 visits, because the more you go, the more the midwives see you, the more the doctors see you, and the more they are able to identify any problems that come up. So do not stay at home. Please go to the hospital. Go for the antenatal. Go for the pregnancy school. Learn more. And also you can register to attend individual classes or group classes if you wish. So that is also good for you. And please don't forget to do every test that you are asked to do, and avoid taking medicines that have not been prescribed for you. I've also told you about some of the foods to avoid. We are looking at what we can do. How can we prevent some of these deaths that we can avoid? And these are some of the things that we can do. And so, ladies and gentlemen, today we have looked at the continuation of stillbirth. We have given you the definition. Any baby born after 28 weeks, some people use lower, 24. We are using 28 weeks pregnancy and does not show any sign of life. Some of them die before the babies are born. Others die when the mother is in labor and come out fresh as if they are asleep. We have looked at some of the causes of these deaths. They can happen in the baby, they can happen in the mother, and they can be as a result of the health system and also the community or the environment in which we find ourselves. Today, we have looked at some of the ways that we can use to help reduce these avoidable deaths. And one of them is that if you go for the antenatal and there's something wrong, if you have an infection, it will be treated. If you have any medical condition, it will be treated. So those ones are avoidable. You don't have to stay with an infection till you deliver stillbirth. No. And the others are that there are certain foods that we don't have to be eating, foods that contain a lot of mercury. And we also have to eat around us. That is why I continue to tell you that just look around you, where you are. Look at the foods that are locally available. Eat those ones. Don't go for the canned food where you don't know for how long it has been in that can, what has gone into it. So eat what is locally available and avoid raw foods. Avoid raw egg, avoid raw seafoods. So try and do that. And then I know somebody will ask about pineapple. Well, it's been said that if you eat it in moderation, that is fine. But in some instances, if people eat too much of it, it causes miscarriage. And I've told you the difference between miscarriage and stillbirth. Miscarriage is early on in pregnancy, before the 28 weeks. Some people say before 20 weeks or 24 weeks. So that is the early loss of pregnancy. That is not what we are talking about. I hope you have learned something new today. And it is not the end of our discussion on stillbirth. We will be looking at, so what happens after a mother has had a stillbirth? What happens to her? What happens to the family? And what can be done? Are there services that are available for this woman and the family? So join me in my next video when I continue with the discussion on stillbirth. We are on this journey to reduce these preventable maternal and newborn deaths, and also help families to live healthy and fulfilled lives. Well, once again, my name is Dr. Linda Vanotoo, and you have not gone ahead and hit that subscribe button. Please do that now. Hit the subscribe button. Turn on the notification bell. You will never miss any program that we bring your way. And share with friends, invite people. And if you are there, you have ever had a stillbirth, and you are still wondering what would happen to you in your next pregnancy, or what can you do? You have still lived with that pain up till now. I'm inviting you to join me. Send me a text message +233 59 242 0625. I know you will do that, and I hope you have learned something today. The last session that we had, I was happy with the feedback. People asking, I didn't know that this was like this. I did not know that this was like that. Now we are learning. And don't forget, the cake counts. If you have not yet done that, when you go for the next antenatal, ask about it. And you'll be taught how to do it, and do it very well, so that you can take quick action if this baby is not moving well, or the baby is moving too frequently. And also, it is not true that babies at the end of pregnancy sleep and therefore they move once in a while. No, all those are not true, because we want to use the activity of the baby to determine how well this baby is doing inside the mother's womb. See you in my next video. Bye for now. Bye.
Pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy, or have questions about fertility and reproductive health? Then join Dr. Linda Vanotoo on Facebook and YouTube every Saturday at 4 p.m. on the online pregnancy school, as she discusses pregnancy, delivery, and childcare with experts.